you, family. You already know. My name is Peace George, aka the Sweet Pea. This is the Daring Dose, where we give it to you one dose at a time. We inspire, we inform, and we make an impact. Today we have Dr. Chi in the house. Guys, it is going to be amazing. I want to know, are you excited? Now, this discussion today, this convo, is not just for people like me who use glasses. It's for every one of us, okay? I don't want any more people to join, the glasses gang. It's all cool and all of that, but trust me, guys, I've been using this for years and I wish I wasn't. So, did you know that over 4 billion adults in the world wear glasses? Okay, over 4 billion. That's 64% of the people in the world. So this is something we need to talk about. Eye health, eye care, whatever you call it. We are at this point where we need to talk about it. Personally, as a parent, I don't want any of my kids wearing glasses. So if there are things I need to do to avoid that, I want to know. So, Dr. Chi, if you're already there, please request to join me. So very briefly, let me just ask, when was the last time you spoke with a vision expert? Please put it there. When was the last time you spoke with a vision expert? Do you think you don't have to because you have good eyesight and all of that? Tell me the reason why. When was the last time? Thank you, Dr. Chi. When was the last time you spoke? Because I use glasses. I get to talk to them every time. But it's not just for people like me. It's for everyone. Okay? Everyone. Hi, Dr. Chi. Oh, hello. I love you, woman. I love you. Give me some energy, Dr. Chi. Some energy. Woo!
Wow.
How you doing, Dr. Chi? Hi, Voke. Thank you for joining. Beam Safia Day. Thank you for joining us. Dr. Chi, how has your day been? I know you're a busy woman. I know. Hi, Salua.
Excellent.
Wow, thank you. Thank you so much. I'm really happy to hear that. So 64% of the people in the world are like me. They use glasses. 64% of adults in the world. So this is something we, don't talk about. Eye health, really? Like, I was just reading up on that. So I've asked my people, my family, when was the last time you spoke with a vision expert? And if you've never done that, I am giving it to you one dose at a time. Dr. Chi is in the house. Okay, so brief bio about Dr. Chi. Dr. Chibuzor Uwadi, a UK certified and award-winning optometrist. She is a fellow of the American Academy of Optometry, FAAO, member of the College of, Dr. Chi, member of the College of Optometrists, MCOPTOM. Did I call that correctly?
MC Optom.
MC Optom, good. UK, Doctor of Optometry, OD, Nigeria. She obtained her postgraduate diploma in community health care, UCL, and a postgraduate certificate in global health from Harvard, USA. Dr. Chi, as popularly known, is also an evangelist. I love you. She's also an evangelist, a published author, a translator, a visionary leader, an optometry trainer, and educator. Dr. Chi is an inspirational speaker at conferences. As a visionary specialist, Dr. Chi helps individuals resolve visual and general health and mindset challenges affecting their visual performance, as well as helping them unleash their purpose, essence, and color in life. As a businesswoman, Dr. Uwadi was the director of one of the branches of Specsavers Opticians in the UK, where she took the business to obtain a national award in optics. She is currently director of Vision Care Logistics Group Limited, an optometry service delivery business. Real, that's the Center for Raising Effective and Authentic Leaders, which is essentially for training. Guys, you're in for a huge dose. Which is essentially for training, mentorship, and amplifying our voice to the global stage and virtual optometry information and education center voice. Dr. Chi is a signpost, a great illuminator, an energy source, a transformer, and a thought leader. Her passion in helping people see clearly goes beyond the field of optometry, as she also brings great light to the mind, helping individuals harness the latent powers within them. Dr. Chi educates people and organizations on how to prevent visual disorders, maintain optimal healthy mindset and body in order to protect and preserve their healthy visual apparatus, which is the eyes. As we all know, the eyes are the windows of the soul. A healthy mind and body results in a healthy vision. Ladies, gentlemen, I present to you Dr. Chi Vision. Oh my, oh my. We call her Dr. Chi Energy. Thank you so much, Dr. Chi.
Thank you. Thank you for having me.
I'm so excited. So, Dr. Chi, the vision, eye health, eye care is something we don't talk about. Can you just tell us what is it and how significant is this?
Wow. Thank you for having me. I really appreciate this opportunity. And
it's a pleasure.
I think for me, for vision, for eyes, we're going to do a little journey. I like traveling. I like journeys. And the journey I'm going to start with is the eyes is a powerful instrument. I can say that the eyes are a very powerful instrument. And that statement stems from the fact that without eyes, you can't see. Without eyes, you probably can't see with your hands or your teeth or your nose. So without eyes, you can't see. But the journey of eyes actually doesn't start with when you are an adult. It begins from conception, from the womb, from the fetus. So the first question I will always ask, if you are a mother, if you are a woman, and if you're pregnant, carrying a child, what are you eating? What are you drinking? What are you smoking? Because what you feed yourself would eventually affect the product, the child you produce. And I will keep it very simple. If you smoke and you're pregnant, or you are an alcoholic, or you use certain drugs, for instance, penicillin, if you take penicillin as a pregnant woman, you will eventually most likely have a child with visual issues, with discoloration on their teeth. If you take certain tablets, which I don't want to say too much, but if you take certain other tablets, you might be born without limbs. Wow. Just what the mom has swallowed. If you drink alcohol, you have things like fetal alcohol syndromes. These are syndromes that make the body markers of a child not meet the criteria of, you know, when a child, you have the body weight, you have the expected length, you have the size of the brain. And when you drink alcohol and you're pregnant, those happen. And sometimes you're born, some children are born with abnormalities, even sometimes without eyes.
Wow.
Kids can be born without eye sockets because of what their moms have eaten. And if perchance you're born prematurely and there are forceps delivery involved, you could result in a squint. And a squint is when you have like cross eyes. If you're Nigerian, they call it 4 o'clock eyes. Just barely,
Yeah.
because the child was prematured, underdeveloped, and there was forceps delivery. Now, moving forward, when children are born, there are expected eye cases that we look out for. If a child comes, maybe I don't deal with babies, and a child is born and you notice they have white pupils. A pupil is where the light goes through in your eyes. And you notice the baby's eye is white. Not necessarily the white part, you know, the black part, the pupil is white. You it could be something more serious, and that is the first time the ophthalmologist, which is an eye specialist, not myself as an optometrist, would get involved. And if a child grows on to develop that cross eye, you know, when your eyes are looking in different ways, I personally would always advise to get to see an optometrist or your health visitor if you're in the UK, where we can start managing those cases and watching to see if they can see clearly, because oftentimes parents don't know that their kids can see. And this matters. If you miss out certain age, you would end up having children who probably would have needed glasses or would have needed corrections or surgeries, and they were not managed properly. So it's important what the mom is eating. How early do you take your kids to get checked? So it's not good enough to say you're in denial. I don't want my kids to wear glasses. Seeing an optometrist isn't just about wearing glasses. It's about making sure that every step of the journey, as a pregnant lady, as a child, as a baby, that the markers, the expected visual standards are met. And that's where we step in. And that's one of the reasons why we're probably having this discussion, because we've had cases where people come to us after it's a bit too late. Because if you're a child, for instance, and you needed to wear glasses as a 6-year-old, a 7-year-old, and by the time you get to the age of 8, it's a bit too late to correct. You know, when people have to wear a patch in their eyes, or when people have to do other things to help resolve their visual problem. But the earlier they say, a stitch in time saves 9. Yes. So that's the beginning of the journey, because the journey of eyes is quite a long journey. Yes.
So it's throughout your lifetime. Is that what you're saying, Dr. Chi?
Throughout lifetime, you need to look after your eyes. You need to look after your eyes. Like I said, what are you eating as a mother? But it's not just the mother. What are you feeding your eyes on as an individual? Because the food you put inside your body is not just to make your skin glow. It's also to make your eyes healthy. We eat oranges every day, don't we? But vitamin C is excellent for the eyes.
Okay. You
have grapes, you have grapefruits, you have oranges, you have kiwi fruits, which are rich in vitamin C. And if you're in Africa, there's loads of healthy vitamins that you can eat that can help build the structures of your eyes. And there are a lot of structures. And so I don't bamboozle people with big names. There are structures that make focusing good. And also food that help, when you eat them, they reduce the amount of damage that could eventually happen. So what you eat, how you eat it, depends, and make you see better, live healthier. You know, the good book says, if your eyes be healthy, your body is full of light. So what are you seeing, and how are you seeing, and what are you eating?
Wow. Okay, so Dr. Chi, you've told us what we should be eating. What shouldn't we be eating? Because, I mean, if you're from Nigeria like me, you know, we eat a lot of carbs and all of that. I love my pounder yam, you know. and I'm hoping that won't be one of them. But what shouldn't we be eating? Since you've mentioned the things we should be eating, what shouldn't you be eating?
I probably won't sit down here and tell you not to eat carbs. Potato is good, for instance,
Okay.
but I'm not going to
Okay.
I'm not going to sit down here and say to you, you know, eat this or don't eat this and all that. So the food you eat is, of course, you have to watch what you eat, but I'm very passionate about mostly vegetables, what you should eat. And, you know, for instance, people talk about carrots, even red palm oils are good for you because it contains things in it that are healthy.
Wow.
Freshwater fish, they are good for you. I'm not very good with saying what you shouldn't eat, because what you shouldn't eat, you should speak to your dietitian. But in terms of what would enable you see better, things like freshwater fish, salmon, they're good for you. They contain things called DHA, which helps you, omega-3s, that they help you. Nuts, peanuts, obviously, those things. But in terms of what you shouldn't eat, speak to your dietitian.
Dietitian about that. Thank you, Dr. G. So what are the things that could, you know, what are these factors that you think can affect one's vision? Like you've mentioned. Okay, go ahead, doctor.
Factors that can affect your vision. Lots. But one of the major factors that comes to mind is smoking, cigarette, tobacco, alcohol. I know somebody would tell me the Bible says eat a little for the stomach. No. Alcohol isn't good. It's not good for you in terms of diabetes. It's not good in terms of you know, like I said, becoming toxic to your baby. So it depends. Probably some people would drink a glass of red wine, but what you eat, alcohol is one of them. Cigarette is another one. Cigarette can be a predisposing factor or even a risk factor for somebody with what they call age-related macular disease. And simply put, macular disease, the macula is the most sensitive part of your eye, where all the images fall. It's the retina is like a photographic plate. So when light hit that, you can either see clearly for distance, see clearly to read, enable you see and distinguish colors, enable you to see well at night. So when the macula, which is that most sensitive part of your eye, is compromised because of cigarette or alcohol or even trauma, then you run a risk of not seeing very well. You run a risk of having what they call curvy vision or distortions, which means you look at straight lines, they don't appear straight, only because you didn't look after yourself. Age on its own is a risk. To be old is a risk. But we already know that being old is a risk, but why complicate the risk? The exposure to UV is a risk. It's lovely to get a suntan, but if you need to do that at the expense of your most expensive instrument, your eye, then you need to take precautionary measures. So exposure, high exposure to UVA, UVB, which is what we see as bright sunlight. The brightness isn't the issue, but is the content. We have a lot of depleted ozone layers, like you know, geographically, but those are not good for the eyes. And when you have high UV exposure, you have what they call cloudy vision, which is cataract. I bet a lot of people have heard of cataract. Cataract is not just age related. It is also due to UV damage. So you can put a suntan cream on your skin, but you can't put it in your eye.
Absolutely.
So you wear sunglasses when you're out in the garden, when you're doing your barbecues, when you're doing certain things. You don't look up in the moon when there's an eclipse because you burn your macula. Remember I said Macula is the most sensitive part of your
Back
eye.
of your eyes.
So you take the precautionary measures. When you do bungee jumping, for instance, it's a lovely sport, jumping from high mountains, but you're at risk of having a detachment of your most sensitive part of your eye, which is the retina.
Wow, I didn't know
when
that.
you're doing kickboxing and boxing and messing around, if somebody punches on your eye, whether knowingly or unknowingly, you have a risk of causing damage to your eyes. So your eyes are precious. So you look after it.
Wow.
Yeah.
Wow, Dr. Chi, thank you so, so much. So let's talk about weight and the eyes. How does your weight affect your eyes?
Ooh, sensitive point.
Very.
I'm not going to come here and criticize fatness because that's not what it's about. Weightness, I'm going to narrow it down to things like obesity and probably risk of diabetes.
Yes.
So in terms of your weight, they've got BMIs, they've got all sorts of measurements that the dietitian comes to play that can advise you on your weight. But in terms of how you relate diabetes, obesity, and the eyes, because when you're talking about diabetes or obesity, for instance, you're overworking your heart. And if you overwork your heart and you expose yourself to risks like hypertension, hypercholesterolemia, which is high increase of cholesterol in the blood, you put your eyes at risk. And when you put your eyes at risk and you come to an optometrist and we look at the back of your eyes, you can have what they call, I'm thinking of not using big words. If you're obese, you can have intracranial hypertension. What it means, a swelling of the brain, vessels around the brain. And this will press onto the optic nerve. The connection to the brain is the optic nerve, but it's in the eye. So why would you want to compress your optic nerve and have an optic nerve disease? An optic nerve disease, there's no simple word to simplify optic nerve apart from it's your connecting point to the brain. And if it is swollen and the swelling of the optic nerve creates a disconnect. So the symptoms, especially anybody could have headaches or could have blurred vision depending on the extreme nature of the disease. So being overweight is a risk. Being diabetic is a risk. Having hypertension is a risk. And these are all associated. And if these things are happening to you, and maybe you're struggling with issue, you can speak to your doctor, speak to the dietitian. And if you're already diabetic, like I discussed with my friend Tonya, I think she's in this call. We did diabetes and the eye on Sunday. So when you're diabetic and your blood sugar is a bit too raised, you probably must have had what they call type 2 diabetes, which means your insulin isn't working right. And the small vessels at the back of your eyes are overworked. They crack up and then create fluids and bleed. And this bleeding, again, will impair your vision and make seeing difficult and sometimes eventually lead to blindness. So weight loss isn't just weight loss about losing weight, because people can be slim and they can still have eye problems. They can still be slim. And if they don't eat the right measure of food, like zinc or vitamin C's and all the makeup that help the eyes, you will still have eye problems. I hope that answers the question.
Yes. Thank you, Dr. Chi. So eye testing, because there might be somebody out there who's saying, oh, this conversation is definitely not for me. I don't wear glasses like peace. Eye testing, who is it for? Not that I don't already know the answer, but I want us to educate people, because people think, oh, it's definitely not for me. I've got great eyes. But who is it for? Eye testing, who is it for?
Wow, thanks for that question. Lovely question, because eye testing isn't really about wearing glasses. No, it's not really about wearing glasses. Rather, I would say to you that coming to see an optometrist is a very holistic thing. It's about knowing how healthy are your eyes. Because you could have something like glaucoma, which is a blinding eye disease and is one of the second leading causes of blindness in the world. And you don't know.
Wow.
And you just think, oh, my eyes are good. I don't have difficulty in seeing long distance. The only way you can find out you've got glaucoma is if you come to see an optometrist. And that's when we check the back of your eyes, we measure your eye pressure, and we do what we call visual field to check your peripheries. That's one. You could have cataracts where you have cloudy vision. You probably don't know. You only know you've got that. You could even have diabetes and you're having fluctuating blood sugar, and you carry on for years, 10, 15, 20 years before you realize, because you haven't had your eye checked. You could have your child who can't see in school, don't understand what the teacher is saying because he can't see until you have it checked. So really, seeing an optometrist is not about coming to me to give you glasses. It's about putting a question forward. How healthy are your eyes? You might not know you've got blood pressure. And when you look into your eyes, I might see a bleed. You can't see a bleed yourself. You don't understand when we ask you questions in the practice. Do you get double vision? Do you get flashing lights? These are typical questions opticians ask. Or do you get floating specks? Things floating around, spider webs. You can't interpret those things. But when you come to specialists like ourselves, optometrists, maybe your GP, or even better still, an ophthalmologist, because when you come to me and I can't deal with it, I refer it to the next competency or refer it to the next specialist. So when you come to us, we know how to analyze your problems and then refer you on if we can't deal with it. So it's not really all about glasses, it's all encompassing.
Okay, thank you, Dr. Chi. So you're saying that there's some things that the eyes can tell you the general health of the body.
Yes, yes, yes.
Can you take us through what and what? Obviously, you mentioned stroke. Are there other things? You mentioned diabetes. Are there other diseases that when you look into people's eyes, you can tell what's going on?
Okay, yes. One of the diseases we can find out from looking into your eyes, just looking into your eyes, is things like leukemia, HIV/AIDS.
Really?
Yes.
Wow.
Sickle cell anemia.
Wow.
Okay. Then, of course, things like strokes. We got strokes of the eye, early signs of blood pressure, or even extensive. I'll give you a little story. I had a consultant come to see me some months ago. He's a consultant, right? He should be able to know. He came in for normal eye test, and I asked him, when last did you have an eye test? He said, 3 years, 4 years. Wow. And when I started looking into his eyes, I asked him, when last did you get your blood pressure checked? He said, never have. I wrote a letter, gave it to him, and guess what? He came back to say thank you because he was confirmed to have chronic hypertension. He was about to have a stroke. And it's not the first time nor the second. So I look into your eyes and I can see these signs. I look into your eyes, you don't know you're diabetic, and I look into your eyes and I see little bleeds that you don't even know about. And the first question, I will take you through basic questions and expectations based on the signs I'm seeing. And your response, I say, okay, I need to write a letter to the next professional, and then they will manage it further. Another
Wow.
storyline is where I saw somebody for, protection level. I would call this lady Mrs. A. Mrs. A came to see me, and she had dry eyes where she didn't have enough tears. But she
Wow.
had
Okay.
itchy mouth, dry eyes, dry mouth, and rashes on her leg. And by the time we finished doing the analysis, I realized even she had a rheumatoid arthritis. I had to do a referral.
Wow.
So you're coming in for an eye test, but I can pick up from your health complaints that these things can either be sight-threatening, life-threatening even, because you can die from certain eye problems.
Wow.
And you can have diabetes that can cause you blindness. You can have swelling of your blood vessels. There are blood vessels at the back of your eyes, which when they swell and bleed, can result in temporary visual loss or permanent visual loss.
Wow.
You can have cotton wool spots. You can have cobwebs, noticing curtain around in your eye. And by the time we find out, you've got a detachment of your retina, which means the most sensitive part of your eye that helps you see has pulled away and you can't see anymore. So there are loads, and the list goes on. And these things, you don't know these things until you see an optometrist. Sometimes your doctor might not know, because if they've got no optometry interest or eye interest, they wouldn't know.
Wow.
So sometimes people say, oh, let me go to the shop and put eye drops. No. What eye drops are you putting? Why are you putting eye drops? Because most of the productions or products here are commercially produced. So you need to get the right advice.
Wow. Thank you, Dr. Chi. So eye testing can save your life. And that's on a period.
Oh, yes. Oh,
okay.
yes.
Wow. Thank you so much, Dr. Chi. So somebody asked a question here. She says, can a constant depression lead to blindness?
Secondarily, it depends on what the triggers of your depression is. Constant depression on its own is more of a mental health issue, and I would consult a psychiatrist, your GP, or psychologist. But if by being depressed you become diabetic, and then that comes into play, or you develop hypertension, that now comes into play. If I notice any changes at the back of your eyes, or if by being depressed you now develop maybe dry eyes, recurrent ulcers in your eyes. So on its own, depression isn't a problem for me to deal with, because I'm not a psychiatrist. But if it has associated problems that is connected to eye problems, that's where I step in.
You're the go-to person. Thank you, Dr. Chi. So there's another question here. It says, does eye issues like myopia, hypermetropia, I hope I pronounced that properly, etc., really gets corrected? Some people shy away from wearing glasses because they feel that once they start, they will never stop.
Okay. I'll tell you a little story. And the story is that there are 5 leading causes of blindness globally, according to World Health Organization. And one of them is uncorrected refractive errors. And what that simply means is that people who have eye problems requiring glasses and they are not corrected. Big words. Myopia is short-sightedness, where images are not focused directly on the retina. They are shorter than the retina. And then hypermetropia, the images are focused, long-sighted, focused behind the retina. So the person, I don't want to call the person a patient, does not focus properly. But if it's within a certain age, you can still focus. And of course, presbyopia or astigmatism, which is rugby-shaped eyeball. Can they be corrected on its own? No. Without glasses, no. So the essence of the whole idea of wearing glasses is when you wear the glasses, it brings the focus onto the retina. Remember, in short-sightedness, It's shorter than the retina where the images are forming. So when you correct with the right pair of glasses, you get the right focus. And when you're long-sighted, the same thing, you focus back on the retina. Vice versa, presbyopia, which is age-old eyes, or astigmatism, which is rugby-shaped eyeballs. But the interesting thing for these problems is that's where it is important to take your children for regular eye exams, because most kids are long-sighted. And when they are long-sighted, because they are born slightly long-sighted and they should overgrow it up to a certain age, but where they don't, in the cases of where people have squint, guess what? The strength of the power of the lens that is uncorrected is so strong, it forces the eye to go inwards or outwards, as the case may be. So the use of corrective measures in terms of glasses realigns the eyes and the person can see. And that's why you have certain things called accommodative squints. And they could be accommodative is you accommodate it, you can see, and when you take off the glasses, it breaks down again. But that I don't want to go into details. You can speak to me, click on my bio and we can talk. But simply put, kids need to be seen early enough, and glasses can only be corrected, and all these things can only be corrected with glasses. So don't go to any place they give you tablets in place of glasses. And that's a disclaimer I'm raising, because I'm not consulting here. But if somebody, you go to a practice and say, if I give you this tablet and you're going to get your glasses stopped, I think you've been duped. But saying that, you can get corrections, laser corrections. Again, details, you can speak to me, because there are different levels of knowledge on this call, and I don't want to confuse any. So there are different things you can do to have corrections. Apart from glasses, you can have contact lenses, but contact lenses isn't for everyone. So contact lenses could work for you and it couldn't work for you. And again, hygiene issues with contact lenses. So corrections. So I want to break that myth that says you're wearing a -7 lenses and you can do without it because you can take tablet. Poof, into the flames. That's a lie. And I'm not saying it because I'm an optometrist. I'm saying it because technically so far, you need to make sure, throw the biases away and look after your kids, look after your eyes, because glasses is about focusing power. You're increasing the focusing power of your eyes when you're wearing it. If you take off the glasses, you lose your focus.
Yes. Thank you, Dr. Chi. Thank you so much. So are there digital devices that can affect the eyes?
Yes.
Okay.
The visual display units, we use it all the time, especially in the pandemics. We've spent a lot of time. One or two things that the computers can do to you is it will cause dry eyes. Because you're staring, especially those gamers, those kids that are always in the computer playing games, you're making your eyes dry. So, and you can produce visual stress on the eyes as well. So you get headaches. We've had increasing number of kids with headaches, even adults with headaches, because everybody is on the computer all the time. So yes, computers, they've got its pluses, but it's got its minuses. But there are rules to the game, which is take rest in between computer use. Take short breaks, look outdoors. There are beautiful scenarios, and you got back garden. And if you don't have a back garden, just imagine it.
I like that. I like that. Yes. I like that. Yes. Thank you so much. So Kemitin 2002, my gold buddy, she says, since she turned 40 years old, she's noticed her vision is clouded, especially in the morning when she wakes up. What do you suggest, Dr. Chi?
Okay,
what do you suggest?
Like I said, this discussion is not my consulting room, but
absolutely,
if you're 40, anybody who is 40, okay, with a few exceptions, would have difficulty reading small prints.
Ooh.
Okay? And in some cases, you can lose that natural ability even earlier than 40. But rule of thumb, age of 40, you start struggling to see small prints. And in most cases like this, people will be doing that, stretching their head to see properly. That is the big word for it is called presbyopia. But if, for instance, which means old age eyes, it doesn't mean you're old. I'm not an ageist. But the truth is, it happens that you lose your natural focusing ability, controlling the ability to see close work. But that is corrected using reading glasses. It's not corrected using tablets. But if you're getting blurred vision on waking up, we need to have more chats than just having this discussion. But if it's just about blurred vision when you're reading small prints, you need to get to see your optometrist, and we can give you some nice reading glasses or varifocals, as the case may be.
Right. Thank you, Dr. Chi. So let's talk about makeup and the eyes. You know, like we women,
wow. I see. I just readjusted.
You know how we do it with makeup. Prime. We use the foundation and all of that.
Wow.
Dr. Chi, makeup and the eyes. I know this is really important, so I want us to talk about it, Dr. Chi. You have the floor.
Makeup and the eyes. What is the content of your makeup? Have you ever studied what the makeup, what it's made up of? Has it got steroids or something that behaves like steroid, for instance? Because if you got a steroid related or look-alike of steroid and you put it on your skin is one of the biggest cells. So you put it on your skin and it gets absorbed and it gets into your eye cells, all the blood vessels. Steroids can trigger glaucoma.
Ooh.
Steroid can trigger cataract, cloudiness of vision. So what you put on your skin, what you put on your eye can cause you blindness. Simply put. I give you an experience of 2 days ago. I saw someone, beautiful girl, and she had very thick eye, you know, red eye and all that. I've seen her before, and this time I looked again. I said, what eye products are you using? She said, no, not much. I looked at her eye again. Are you wearing false lashes? She said, yes. I looked again, and I said, I need those lashes out straight away.
Wow.
Because the lashes were creating the infection and allergy. She said to me they used a glue to glue it.
Ooh,
Queens, hear me out. Don't make yourself blind. You want to look beautiful, queens? You don't have to use. This is my real eye.
Ooh, slay mamas.
And if you
hear that?
Wear things in the eye. What's it called? Mascara. Use the one that is non-allergic, that will not make you blind.
Whoa.
Because it's good to look beautiful. It's good to look nice. But I'm very so health conscious that even up to the powders, I haven't got any blushes. This is my normal color. So you use things that will not kill you later. You use things that will not cause you cancer later. So look at what you're putting on your skin, what you're putting on your lips. If you don't have anything to put, go and get red apple. But keep it simple. Keep it simple.
So don't slay yourself while you're trying to be a slay queen.
Oh, you're putting things on your nails that will cause you cancer of the nails. You're putting wigs that will not get you infected skulls. Why?
Father Lord.
Why? Hey. You're using products that will leave you permanent. I mean, here we do Halloween or whatever. People use contact lenses. Once we had a patient who had 37 lenses in their eye. How? She must have been drunk.
Whoa.
So they had to surgically remove the contact lens. Another, they had to surgically remove her eyelash because the glue got stuck. Another one, the glue damaged her cornea. The cornea is the transparent part of your eye. Why?
Fashion,
The guy that you want to toast you is not looking your side.
Hey,
keep it simple. Keep it stupidly simple. Look after your eyes. And when you look after your eyes, it will look after you. You're using certain bird soap that clearly would make your skin pale and kill you later and affect your eyes and cause you cataract because they cause things that cause damage. Because some of the chemicals we are putting, they've got all sorts of debilitating content and we may not know. Okay, so there's so much. I don't want to mention name because of my insurance don't cover me to get sued by companies. So you need to look after your eyes. You need to look at the content of things you're rubbing on your eyelids, eyelash, face, lips, and things you're inhaling or eating even. Sometimes they tell people to take tablets to make their skin good. Check what you're taking. Check what you're rubbing. I mean, makeup is a big one. So probably something we need to deal with. But it's so generally, we need to be careful what we are putting on our face.
Wow.
Your eyes haven't got duplicate, you know?
No spare parts.
No.
Thank you, Dr. Chi. So you've been saying watch what you use, so what should, when it comes to makeup and what we use for our face, because they tend to go in the eyes. I used some before coming on the show today, and yes, I had some going into my eyes. So what is that thing that I should avoid? So if I picked up one powder now and I read through it, what should I avoid?
I don't know particular names because people react to different things.
Oh, okay.
So you should do testers first. One, if you notice a chemical name, just Google it and find out what it really means. Stick to water soluble things, and if you don't have to wear makeup, use water. Use normal things like shea butter. Nobody reacts to shea butter unless you do. But keep it, like they said, stupidly simple.
Stupidly simple.
Yes, don't go too deep. You don't have to be Mariah Carey. I'll give you an instance. I went to Harrods a few years ago. Somebody said to me to buy a serum. And he said it will make me live forever. And I want to live forever. So I bought my serum. I spent 75 quid on it. 75 pounds. Harrods. It's good, isn't it? And I put this serum on my skin. Within a few hours, I had Botox mouth. You know Botox mouth? My lips went like that. I didn't think it was my 75 pounds that cost it. So I didn't use it again. And another time I put it on my skin, I reacted. But some people look at the label and say, no, it's my money. I cannot throw it away. But I didn't use it again. But that's an extreme. So I don't know the content. I didn't even bother. But such things, you don't have to be Mariah Carey. You don't have to be Kardashian. You don't have to be anybody. Be you. Do you.
Be you.
You can manufacture your own, You can manufacture their natural things. Papaya is good for you, for the skin. Look for natural products you can create. Get creative. You're a child of God, man. Just get creative and produce what is good for your body. And for your attention, your brown skin, you're not Oyibo. Apologies to my white family. So somehow find out what is good for you and use it, and then you can live longer.
Do you? So be sensitive to the products that you use.
Be careful.
Dr. Chi. Dr. Chi. So be mindful of what you use on your body. Like you've taken us to the uni and back. Dr. Chi. Thank you so, so much. So any last words for the people out there, Dr. Chi? How can we find you? Let's talk about your book. Your book is coming out this...
Yes, end of March. I've got a book coming out. I'll keep the name very secret. I'm working on it, so I'm hoping to get it out by the end of
So stay tuned, guys. So how can we reach your handle, Dr. Chi?
My handle is Dr. Chi Vision. So that's me on, and I've got my website coming on again. That is on the wraps, and when that comes out, and you can reach me on that as well. And apart from eyes, I'm a transformational catalyst and coach. So I do coach, I do mentor people, and I also do work, with people regarding their eyes.
Yeah.
I've got a leadership social enterprise where I raise leaders, especially for Africa. We need to be people of impact and change our world. So I'm not just all about eyes. I'm a totality of vision, giving you all the way. Yes.
Ooh. So, Dr. Chi, let's talk about your charity.
Yes.
Am I right? Yeah. So can you just quickly say something about your charity?
Okay. One of them is called CUROPS, CUROPS, and that is Chibuzor Uwadi Reach Out programs. And what I do with CUROPS is I reach out to essential workers. I cook chicken, rice, and plantain, and I take it to the police, ambulance, and all that. And I do that in the community as one of my social impacts. And then my Center for Raising Effective and Authentic Leaders, I help young people, give them sense of direction, empower them, and give them a sense of meaning. Because especially in these times, a lot of people are confused, overwhelmed, not sure what to do. In that, we're still developing it, but it's where we're going to help train people to have skills, to gain capacity and grow and become something, for themselves and adding meaning to their life. Yes.
Thank you, Dr. Chi. I also heard that you're doing something for primary schools in Africa.
That is cooking. That is cooking. We're going to Africa with glasses. We're going to Africa with glasses. We're just waiting for the COVID to go down so that our team, we're forming a lovely team. You can volunteer to come with us. And
I do.
Yes,
I'm volunteering right now.
Schools.
Yes,
we're going to help educate kids. Yes, that's what we're going to do. Yes.
Thank you so much, Dr. Chi. It's been so amazing having you on the Daring Dose. Hey, people, we dare you to take care of your eyes. And that's what Dr. Chi is here for. Take care of your eyes. Our handle is Dr. Chi Vision. So please reach out. If you need to talk about your vision, reach out. Thank you so much, Dr. Chi. I don't even know how much. You have no idea. I have learned a lot.
I'm glad.
What I can say is thank you.
It's Double HR.